Now I'm very excited to and grateful to introduce you to Dr. Garrett Mail, who is the Unit Head of Digital Health Technology in the Digital Health and Innovation Department of the World Health Organization in Switzerland and leads work related to digitizing WHO's health and data recommendations. Today, he'll be discussing the search for universal agreement and documentation.
Great. Thank you so much. And let me share my screen. Great. Thank you so much. So I'm going to talk a little bit about the work that we've been doing and a document that will be released this coming Friday. I think a number of months back, WHO was approached by many countries and software developers that were directly reaching out to WHO, either looking for guidance or positioning their software as a viable solution that might be relevant for many countries. And we started to recognize that there were many different features, different data collected, and there were different terms of use and different functionalities across these different digital solutions that were aiming to provide a vaccination certificate or proof of history of infection or lab results. And we at WHO quickly realized that as a neutral technical agency in the UN, we wouldn't be in a position to select one particular digital product and recommend it to countries, but rather member states of WHO would need guidance to ensure that they were able to be informed and select digital solutions that would meet their needs. Furthermore, there was inequitable access to vaccines, and that we wanted to ensure that individuals were not prevented from travel or private or public venues, but that there would be guidance that member states could use to advise on how to implement these solutions. And lastly, given that often the historical prior versions of these solutions were paper in nature, that there was the potential for fraudulent development of these certificates, and that there needed to be some guidance to help mitigate fraud and ensure that there was public trust in these kinds of solutions. I think we're all aware of, but it may be helpful just to provide a little bit of a simple overview of vaccination is provided and a certificate is issued by a public health authority. Those authorities are identified at a regional or at a national level, and certificates are for countries that are centralized. There is an ability to ensure that there's a directory of those public health authorities issuing certificates, and that when that individual enters into another country, there's a need for verification. And so there's an issuer and there's a verifier, and there's a need for consistent data representation, and there is a need for trust in where the vaccination certificate has been issued by the verifier, so that they, without subjectivity, can know whether or not that certificate is valid. WHO international health regulations have been, this is a mechanism that is international policy for WHO member states. And the International Health Regulations Emergency Committee recommended to WHO as advice that WHO work with and establish standards for digital documentation in relation to travel related risk reduction measures to ensure that there would be the potential for interoperable digital platforms. In April, they recognized that there was a need for both paper and digital, and that it would also need to recognize not just vaccination status, but testing and recovery or history of infection status in the context of international travel. And lastly, there was a recommendation in July that WHO focus also on updating the International Certificate of Vaccination and Prophylaxis, which is, some people know, the yellow vaccination card that some countries use for domestic documentation of vaccinations, but a small number of countries require for yellow fever vaccination and polio certificate status. So our aim was really to achieve an implementable specification and standards so that any application of a digital vaccination certificate for either domestic or cross-border purposes would be able to represent data in a consistent way, ensuring functionality that would enable data exchange and privacy and security, that all users would have collective trust in the system, and that it would facilitate the use cases of continuity of care, verifiable proof, and that individuals would have access to that information for certificates. We recognize that countries themselves would need to choose the modality of implementation, whether it was paper or augmented paper or a full smartphone or a digital tool, that there would be multiple solutions potentially being used in a country, that countries themselves would need to ensure that they had the policies to support the issuance and verification approaches, and that there would be an option for countries to determine which identification they might use and whether or not they would want to bind that to the certificate with the identity. Lastly, we recognize that there was an emergence of trust frameworks, including the EU, as well as ICAO, and that countries would need to select and choose which framework they would want to link to, or whether they would want to pursue bilateral agreements with countries for establishing trust and equivalence to their own standards for issuing certificates. So the objectives that we had were really to publish specifications and standards for data representation, helping those who are developing solutions or adapting solutions to know what functionality would be important, that they would also have guidance around national trust architecture, and in this case, we recognize the viability of the public key infrastructure globally, both for offline and online use, that we would help countries to understand and learn from successes and failures that countries had already encountered, and that digital products that were being developed could be assessed against the specifications so that countries would have a variety of options to select from, and that we would provide guidance about how to implement. We recognized as well that there were already sort of multiple formats that countries were familiar with, whether it was for the purposes of international travel, the ICVP and the yellow card, and the recommendations from the emergency committee recognized that countries would likely be using this as one alternative, as well as the national paper versions of immunization records, both the home-based records that they may be using for the purposes of immunization on a routine basis, or those that were specific to COVID. And then the examples that we provide here on augmented paper that digitally links through a QR code to the public key infrastructure, whether it's on a smartphone or whether it's a 2D barcode that enables that verifiable credential. We recognize that there were these two scenarios of use, the continuity of care that helps ensure that an individual has a record of their vaccination and that they're able to come back in time for potentially a second vaccination, or at least to have a record for themselves, that it forms part of a personal health record as a medical document. And then also the proof of vaccination scenario. And this is really the one that probably has taken a considerable amount of thinking and use for the cross-border purposes. But as Adam has also indicated, for domestic uses as well, so that the vaccination can be verified and validated by an interested party. The guidance itself that will be released on Friday really documents the business processes, workflows, and use cases. It includes core data elements. It details the functional and non-functional requirements of digital solutions that may be adapted or used by countries or built by countries. That there is a recognition that public key infrastructure and the ability to issue those certificates using a PKI is helpful at a national level. We also include a level 7 fire implementation guide, which is really details the machine readable content and the way that data should be represented for consistent interoperability between systems. We also detail principles and ethical considerations and national governance, recognizing that countries value these as well. Just an illustrative example of the functional requirements for continuity of care. I won't go into this in any detail, but just to know that we detail both paper, offline digital, and online digital, and the requirements that are optional or required. We also recognize that in the case of, as Adam has illustrated, that countries may want to link to other countries or to regional networks. The European Union has developed a trust framework in which their member states are able to share their public keys so that another country can check and see whether or not that certificate is valid. In this case, we recognize that there are bilateral agreements that are emerging, as well as there are existing infrastructure that may already be in place, such as ICAO's e-passport that can be adapted and made where the specifications for data that we include here can then be applied through those systems. We recognize that these systems at a global level should ensure privacy and only share relevant data when necessary. The core data set is illustrative of the optional and the required elements, and then are also detailed in the fire implementation guide that really helps provide specificity to how a digital solution will need to be coded so that it can be interoperable with another system. Last, I'll just note that the digital documentation of COVID certificates helps to ensure that there's a personal record serving the holder to support continuity of care and proof of vaccination. But it also serves, this standard is important as it serves as a core foundation that will evolve with the needs of the individual and the immunization program and the health system. We recognize that the science around COVID evolves, and the member states and their implementation will need to acknowledge and recognize the changing science. And so we haven't placed a value on any of these different elements. We just recognize that these different pieces are important for documentation. The interpretation of those data are then done by countries themselves. The specifications are in that durable, future-proof digital format designed using the HL7 International Patient Summary Standard, meaning that you or anyone else with a smartphone would be able to retain your own health record digitally, and the foundations are there to expand and evolve your immunization record as well as the personal and health system needs. And following the International Health Committee advice to WHO, WHO will also be issuing specifications for other certificates, including the history of infection status and the test results. I'll stop there and thanks so much.